Hi, dear. Welcome back to The Wellness Coach. If you're following our week-by-week pregnancy series, you're right on track. Today, we're diving into week 2 of your pregnancy journey. It might surprise you, but you're still technically not pregnant yet. Sounds confusing, right? Don't worry, we'll explain everything, from your body's ovulation magic to what your partner and family can do to support you this week. Let's get started. Baby's development, the pre-pregnancy magic. At this stage, there is still no fertilized egg, but your body is working behind the scenes to prepare for it. This is the week your ovaries gear up to release an egg, a process called ovulation. The egg is maturing inside a fluid-filled sac called a follicle, and it will be released around day 14 of your menstrual cycle, assuming a typical 28-day cycle. If sperm meets the egg during ovulation, fertilization can happen, and that's when true pregnancy begins. So week 2 is still part of the trying to conceive phase. What's happening in the mother's body? Even though you're not officially pregnant yet, your reproductive system is in full swing preparing for the big moment. Your body is producing luteinizing hormone, LH, and follicle-stimulating hormone, FSH, to stimulate egg growth. Estrogen levels rise, helping to build up your uterine lining to welcome a potential fertilized egg. Cervical mucus becomes thinner and stretchy, creating a sperm-friendly environment. You may start noticing signs of ovulation like a slight increase in basal body temperature if you're tracking it, mild cramping on one side of the abdomen, called Mittelschmerz, or even increased libido. Symptoms to expect. Most women don't feel anything unusual yet, but if you're tracking your cycle, you might pick up on some subtle signs. Mild lower abdominal twinges, egg white cervical mucus, breast tenderness, slight mood shifts. This is the week many couples trying to conceive start using ovulation predictor kits or monitoring basal body temperature to time intercourse optimally. Doctor visits or tests. At this point, routine pregnancy-related doctor visits haven't begun, but if you're actively trying to conceive, preconception care is important. You can schedule a visit with your OB/GYN to review your cycle and health history, check for any underlying issues like PCOS or thyroid conditions, get recommendations on prenatal vitamins, especially folic acid. Tip: start taking 400 to 800 micrograms of folic acid daily to prevent neural tube defects later in pregnancy. Nutrition and wellness tips. Now is the time to fuel your body like you're already pregnant. What you eat this week could support early embryo development if conception happens. Top fertility-boosting foods for week 2: leafy greens, lentils, and citrus fruits rich in folate. Whole grains and beans support hormone balance. Pumpkin seeds and almonds high in zinc and vitamin E. Salmon, sardines, and chia seeds, omega-3s for healthy eggs. Stay hydrated. Avoid alcohol, smoking, and excess caffeine. Manage stress. Try yoga, meditation, or simply walking outside. Emotional and mental health check-in. This waiting period can be emotionally intense, especially if you're trying to conceive. You may feel excited and hopeful, nervous or anxious, impatient or confused. These feelings are completely valid. Use this week to build healthy mental habits. Journal your thoughts and track your cycle. Practice gratitude and positive affirmations. Lean on your partner or a close friend for support. Tips for partners and family. Partners, you have an important role even this early. Be attentive, ask how your partner is feeling. Help prepare healthy meals. Join her in wellness routines like walks or meditation. Be part of the planning and baby talk, even if conception hasn't happened yet. For family members, offer gentle encouragement, respect privacy, and avoid too many questions. Trying to conceive can be sensitive and deeply personal. Wrap up and what's next, Week 3, Preview. That's a wrap on Week 2. Even though fertilization hasn't officially happened yet, your body is setting the stage for something incredible. Stay patient, stay hopeful, and take care of yourself like the miracle is already happening. In Week 3, we'll explore what happens right after fertilization, how the egg and sperm meet and begin forming the earliest stage of your baby. Don't miss it. Don't forget to like, subscribe, and click the bell icon so you never miss a week on your pregnancy journey. You're not alone in this. We're here every step of the way.